Hi, I'm Dr. Craig Escude. Welcome to Medical Monday. We're going to spend a minute talking about swallowing issues in people with intellectual and developmental disabilities. One of the studies I've read recently showed that around 65% of people with intellectual and developmental disabilities have some issue with swallowing. And of course, the more significant the level of disability, often the more problems a person is likely to have with swallowing. So when we have trouble swallowing, it puts us at risk. For the biggest thing it puts us at risk for is aspiration, where things get into the lungs and can set up infection and cause lots of problems. It also puts us at increased risk for choking episodes as well, too. And besides, health outcomes in that way, it's uncomfortable and it's challenging if you aren't able to swallow well. It can make eating unpleasant, which can cause behavioral issues as well too. And that's something to think about. That sometimes a person's behavioral issues that they're having, it may actually be them trying to communicate that they're having problems somewhere else in their body. And what we're talking about today are swallowing issues. So if a person is having trouble swallowing, what behaviors might you see? Well, let's say every time they get close to, say, a dining table, they become agitated because they know that usually means eating, and they might start having some fear that it's going to be uncomfortable or difficult. Any aggression around meal times could be an indication if someone can't verbally tell you something that's going on like that. If a person has coughing while eating or drinking, that is a big sign of a swallowing issue, and the aspiration might actually be occurring, and that should definitely be evaluated. Sometimes people require a lot more time to eat, again, because they're having trouble swallowing, and it does take a lot. Swallowing, happens very easily for most of us. We don't think about it, but it's a pretty complex process that needs to occur to get food into the mouth, down, all the way down in the back, and to go down to the right spot. Food gets stuck in someone's mouth. If you see people that seem to maybe be a little short of breath after meals, or just have a little bit of a hard time breathing during meals or after meals, that could certainly be signs of a swallowing problem as well too. So think about all of these things if you see these types of issues and behaviors, and make sure someone is evaluated for potential swallowing problems if you expect them. Pretty easy to evaluate. You can do a simple swallowing study where you have a team and they watch the person eat and just basically observe different things that happen. But you can also do what's called a modified barium swallow, which is a test where you eat and drink some chalky things of different consistencies, and they can actually look and see how the swallowing process is working and if things are going down in the right way. So think about those things, be aware of swallowing issues and the potential problems that it can cause, and have a person evaluated if you expect that there are any issues or any trouble swallowing at all.